patients who are using medicinal marijuana for pain and other chronic symptoms are getting turned down by insurers right now, even in states where medicinal marijuana is legal. Insurers are basically reluctant to cover it because of conflicting laws, because of, as far as the FDA is concerned, because it's the Federal Drug Administration, medicinal marijuana is not legal. So now we have people with cancer and AIDS and all kinds of other drugs that are finding something that is helping them and helping them deal with pain. And now again, we have the federal government coming in and stopping the insurers from allowing these people to medicate themselves. This, to me, this is like the worst of the worst.
Well, I got the impression that it was the insurance companies choosing not to. Not
well,
that
it is, but it's because it's under the
legal
guise.
Limbo.
Right, yeah.
And because of that legal limbo, it's understandable that a big company would not want to step in the middle of that until it's actually figured out whether or not they are assisting in the commission of a crime by covering it with insurance versus not. So
yes,
I can
thank you for
understand
cleaning that up.
But what I would say is, duh, insurance companies never really do want to add coverage for things. That means they have to pay out more money. They're not interested in that. So
yeah.
I can see them also saying, we'll just wait because that means that we have to put out more money for something, and we're not going to do that if we don't have to.
Right. So like everything, does this just come down to money? Because to me, the FDA loves everything in pill form, and when you have everything in pill form, there's also 3 minutes of diarrhea and possible suicide and death and all that other stuff that comes with every one of those commercials. All the people dancing and they're happy, but they're also having diarrhea and death and all that kind of stuff.
Yes.
And thoughts of suicide.
They were inevitable anyway.
Yeah. So is this partially because marijuana just doesn't have, we don't have a pill yet. We don't have just that perfect pill. And also that when it comes out one day, which it will, it's not going to have all those side effects because weed doesn't have those side effects.
Yeah.
So is this just like a failure of the system at the highest level?
Side effects, I don't know. I mean, it depends on who you talk to.
You get paranoid or whatever, but
you're not depends on how much you use, for sure.
I've never been with anyone who's smoking weed and suddenly had horrible diarrhea.
There you go.
You were lucky, sir. Let me tell you.
I've been around some good weed people.
Yeah, in Indiana, our weed isn't that good.
Not
you
good.
don't know what's going to happen. Usually it's laced with some kind of benzodiazepine or some crazy shit.
Which the FDA is totally for, by the way.
Yeah.
Is that a real thing? I thought I just made that up.
Yeah,
it sounds real, doesn't it?
It sounds real, might as well be.
It would be something that would give you diarrhea, right?
Yeah, exactly. There's something that starts with benzo that the FDA is for. So
Yes.
Yeah, close enough.
Benzoil, it's car oil, motor oil. Well, okay. Yes, it is money, and it does come down to money. Was that your question?
Yes.
I don't even remember.
Yeah.
But who's spending $1,000 a month on weed?
People who are very sick.
So yeah, if you're very sick, you could. I know. I saw this and I thought the same thing.
In that sense, I know a guy who can cut that in half for you, because he'll give you as much as you ever want. But that seems like a very large amount, even to the point if you were trying to medicate every day.
Yeah, I
right,
thought.
but I don't want to get caught in the semantics of
but let's talk about if you are somebody who is truly disabled by some kind of condition that makes it so you can't work, then yeah, you're going to be on disability, which pays very little, and then the only medication that gives you any relief is something that's not covered. I mean, I can understand it does put people who are poor because of their disability into a huge bind. I don't know how we solve that particular problem, because personally, I'm not sure it's a good idea to get the FDA involved in studying and testing and approving marijuana, because we've seen what they do with the pharmaceutical industry. And we see, I just see marijuana.
So where do you see that going?
I really don't know, because if they do, I see it turning into pill form. I see it, losing its effectiveness. I see it being a controlled market, and that means that big pharmaceuticals companies will take over, and then it kind of ruins it for everybody, because we've seen what happens with everything when the suits get involved.
Right. So, okay. So I'm on board that. So then, what do we do related to insurance then? So then that's the part.
Maybe there's a way for the federal government to end the legal limbo aspect and say, okay, if you're in a state that has decided to allow for recreational or medicinal marijuana, if you're in a state that does that, then we are not going to prosecute you, and give insurance companies direct and specific legal guidance that they can offer that without themselves getting into some kind of accessory related crime.
Right, which, going back to the previous story, that seems to be in line with the thinking of what Obama and Holder should be doing.
Why don't they do it?
They just don't seem to be doing it.
I know.
So go ahead.
No, I just think that as far as the drug companies go, though, those need to be the people who step up and make an actually effective product. Because for all of the people who
But they're selling a lot of other shit.
Yeah, but it's another opportunity for them to do something right. They're not all horrible. I mean, they make a lot of really good things that help a lot of really sick people. And I think that they obviously wouldn't exist if they were killing everybody with diarrhea and nausea
Oh,
all
sure.
the time. And I just want to, you know, I think that as we go forward with this, as things change, it'll obviously, you know, like I said before, it's just something that's sort of caught in this weird gray area right now.
Yeah, we're working through, I think, these issues. What I think one thing that could be done is when people make sure that they tell their representatives at the local, state, and national level, we want to make this legal and we want to end this legal limbo, and Congress has the power to do that more so, I think, than Obama with executive actions. He can only do so much, but if it's built into the law, you know, if we demand that of our representatives, you know, there is a possibility that it could happen.
So to get us to demand that, do we need like a George Clooney to jump on board the weed thing publicly? Instead of, it seems like you talk about weed and everyone, you go to the easy jokes. I get it. You know, we could go to Snoop Dogg and Willie Nelson.
Woody
Harrelson. Do we need someone like a Clooney to literally get sick and then be like, this is how I'm helping myself, and that would be the thing that would get people to realize how screwed up the system is?
I think that would help. You know, I don't know.
I'm not wishing sickness on George Clooney.
No, but having enough.
You looked at me like, oh Lord.
You're like just you're pondering.
No, I was not.
That
here. Was not a shot at George Clooney.
I wasn't thinking about.
I wish him nothing but health.
I don't think he has to get sick. I would prefer it not that way.
Right.
That it's somebody who basically says
this
is a civil libertarian issue, and we can all basically say get the government out of our lives in this particular area. You know, and just move forward with that. You know, maybe having a famous spokesperson, a celebrity spokesperson, would be the trick to help galvanize people to tell their representatives, but you know, it's taken a long time to even get to the point where we are now, where we have
bring us home, Andy.
Laws.
Yeah, I don't know. There you go.
You don't want to besmirch the good name of George Clooney.
I think that I think celebrities doing things that are political, I hate so much anyway that it's like it's an eye roller for me as you know, somebody who doesn't watch TMZ every single day.
Right.
So I don't know.
So it would be ineffective
for me, but my mind's already made up, so maybe I'm not a really good person to ask.